1 in 4 families in the country is dealing with mental health. Sure, there's still a stigma, but it's finally gaining the national attention it deserves. Welcome to Comcast Newsmakers. I'm Ken Ackerman. Joining us is Chris Bouneff. He's Executive Director of NAMI, Oregon. Thanks so much for being with us.
You're welcome.
Before we get into it, let's talk a little bit about NAMI.
Sure. Well, NAMI is, we're the state chapter of the National Alliance on Mental Illness. We're a national organization, a membership organization composed of families and individuals affected by mental illness. And our role really is to help families and individuals out. So we provide free support and education programs and assist people in navigating what sometimes is a very complex system to seek mental health and addiction services.
Not only complex, but a system that has a stigma attached to it, which keeps it sort of at a whisper's level.
It does, and it has for a long time. I mean, the brain is something we don't really understand that well, even with all our advances in science. Because mental health and addiction often impacts the way we interact with the world, the way we view the world, the way we behave, it's very much been misunderstood as a character trait, flaw, or some type of moral failing. And because of that, people feel a lot of shame when they're affected by mental health issues.
You know, when it becomes an issue in the national spotlight, good for the industry, bad, obviously, for most people who see it and who are involved. But let's talk a little bit about an actor or an athlete, say Robin Williams.
Sure. I mean, these are huge tragedies. They, in these cases, are very public tragedies. Suicide is a huge public health problem, one of the leading causes of death among our young people. But when you have a national tragedy in the past, we might wring our hands and then not pay attention to it and move on with our lives. More and more when we have these high-profile incidences, what they do is they draw communities into conversations, and we're talking about not poor Robin Williams or poor so-and-so. We're talking about how do we prevent this in our society? How do we get more people help sooner so that we don't have these type of tragic outcomes?
When it comes to mental illness, is healthcare reform working as it intended?
It's so far so good is what we would say. You have a lot more people having access to insurance benefits that allow them to access treatment because you have, we're really very much in the infancy in this coming out in the open, but it's out in the open. And so because you have more people covered, you're beginning to have more people really reach out for help much sooner than they would have in the past.
Are you finding primary doctors are becoming more educated?
They are starting to, yes. I mean, one of the big issues used to be you would go to your primary care physician. That would be where you would start when you have any type of trouble, and they didn't know exactly how to respond. More and more, our healthcare delivery system is understanding that it's not just medical care that they're there to deliver. They're there also to take care of our whole body. So that includes our brain. And when it misfires, when something goes wrong there, more and more our primary care is understanding that treatment can't start and stop there. We need to send people to the expertise they need to get better.
Is it true it would normally, and in the past, I'm not even sure currently, would take a long time before someone is diagnosed with a mental illness?
That is true. On average, it would take, and still does, about 8 years between the time someone has their first symptoms and they get the appropriate help that we know would address their diagnosis. Again, a lot of it is this has remained in the shadows for so long. A lot of it is we just didn't have the science underpinning what's going on with someone, and a lot of it is we had healthcare systems that when you first reached out to help didn't know how to get you into the right kind of care. It's not perfect, it's not great yet, but this is a time of a lot of optimism because we're having conversations we have never had as a community before.
All right. Very good. Chris Bouneff, thank you so much for joining us on Comcast Newsmakers. Always a pleasure. We want to thank you for being here as well. We're at the Gresham Historic Museum in downtown Gresham. For the crew here at Comcast Newsmakers, I'm Ken Ackerman. Make it a great day, everyone.